Hi everyone, I'm here with Dr. Abby Neville, the geriatric house called Dentist, serving Philadelphia and surrounding areas. I'm Anneliese Kaufman, serving Manhattan and only Manhattan. That's a lot. That's a lot because I am on buses, trains,
right.
Ubers,
I have
cabs.
heard that. Actually, been on the phone with her when she is crossing the street. So
it's a lot. It's a lot, but I love it. I want to talk about our practice, which we have so many similarities, and that's really why we're all together. We're bonding forces because power is in numbers.
Right.
And when we first chatted, we talked about our practices. And not only do we go to people's homes, we go to nursing homes, assisted living homes, hospice care homes. Am I missing anything?
Yeah, even things like convents.
Oh yeah.
Group homes, places where there's several people living that all would need to be transported. That may not be that simple. And something like a convent is obviously they would also have to be transported as well. And why not have us come to them?
Exactly. We could do everything in the home. So what is your favorite type of day?
My favorite type of day would be a mix of everything. I like to be busy. I like to be all over the place. Obviously, that's why I'm a mobile dentist. I like change. I thrive off of things like that. So I would say my favorite day would be a day going to a couple people's homes. Believe it or not, hospice patients, when I looked back, I would never have thought that I would have been doing this as a career, seeing a hospice patient, but it really is desperately needed. Sometimes it's just to smooth a tooth off so they can be more comfortable. So go to a couple homes, go to some of my favorite nursing homes, say hello to all the people in the hallway.
Hi.
Even if I'm not seeing them that day, and they love to come out and say hello to us. They wish that we would see them all the time. I have one lady who wants me to clean her teeth every time I go, even if I'm not supposed to be there to see her, but she likes the way it feels. And then there's actually I go to a senior living community, and if we can bring a couple people to a clubhouse and actually see 3 or 4 patients in their clubhouse and just chit chat, do some dental work.
I'll tell you, it's a little like being a real estate agent. You get to look at people's stuff. An Avon lady, you get to ring the doorbell. A doctor, which we are, a dentist, and a friend and a companion.
Yeah.
I mean, it's a lot of fun. It's unbelievable sometimes that we fell into this for whatever reason. But I've been doing it a long time, and I can't imagine like going to my office every day and wondering if my secretary's going to have to call out because her kid is sick again. I mean, we have none of that. We always show up. We're better than the mail delivery and Verizon. So you can count on us. Maybe not exactly at the time, which by the way, I want to talk about.
That's another thing.
Let's talk about that.
Yeah.
So we give you an appointment time for 2:00, and at 1 minute to 2, they're calling, where are you? And there might be traffic and there might be a hard time parking. So know that, I sometimes remember to tell them a range.
That's what we do.
I try.
We always give a range because, especially if we're traveling to multiple places, being in the Philadelphia suburbs, we could be in Bucks County, all the way to Montgomery County, back into the city. So there's a lot of variables. It also depends on what we're doing on the patient before. So sometimes things happen quickly and we'll give you a call and say, hey, we're running a few minutes early. Would you like for us to come over now? Or we'll call you and say, you know what, the last patient took a little bit longer. We just asked for some patience. It's very similar to, when a caregiver or a nurse comes over, I know they give you a range as well. We're exactly the same.
Yeah. We have some funny stories, I'll tell you.
Yes, we do.
I have a guy who, very end stage dementia, but I swear he remembers who I am every time I come. You're the dental lady, aren't you? Yeah. So that's really unbelievable, and his kids can't believe it. I have patients who absolutely would not allow anyone else in their mouth, but for some reason they allow me. I know, it's crazy.
It is.
So you never know. I mean, we are really experienced with that.
I think that they can sense it almost. I really do, because I'll even have my assistants will say to me, I tried this impression, they wouldn't let me do it, and then for some reason I go in there and I don't know what it is. Maybe they just know that I've done it a million times and they figure it's okay if she does it. But it happens a lot, actually.
I had a woman, my favorite story ever. I have this woman who is my age, and she was bitten by a mosquito and went into a coma and she lost her front laminate, and her children were so upset because she was such a beautiful woman, and they couldn't look at her. So while she's in the coma, I fixed her tooth, and they say that if you don't come out after 1 year, you're pretty much, it's horrible, that you might not ever come back from that. And she did. And I always told her, telling her the story of how she let me, and they couldn't believe it. Like, she literally opened her mouth and she participated by allowing me to just do what I had to do. And now she's like 90%. She's completely good in the brain.
It's really cool.
It's amazing. And I just love her, and I'm still her dentist, and she doesn't want to go back to her old dentist. But we have these stories that are like miracles.
Yeah.
Can you think of one story?
I can think of one. I had a stroke patient, actually, who was nonverbal, and we really didn't think that he would ever be able to speak again. But you could see it in his eyes. He was trying to talk to you with his eyes. And actually, music was the first way. So he would sing to me, actually. And then he did eventually speak again. And it was a situation where they never thought that he would. And we got to be there with him during that process. And so when he sang to me, I'd sing back. Not very well, but I would. But that seemed to be how he was able to communicate. And he didn't regain, it wasn't perfect, but he could talk to us.
Yeah.
And you can see that they're inside trying to communicate, and it's just a very gratifying job that we have.
Well, you can see we are very passionate about what we do, and we love it. I mean, sometimes I think, wow, I get paid to do this?
It's true.
It's really...
doesn't really feel like a job.
Sometimes it really doesn't. It really, really doesn't. Well, I hope you enjoyed listening to us, and any questions, you know how to get us. Look up Geriatric House Call Dentistry, fill out the form, and we'll be happy to answer any and all of your questions. So enjoy your day.